Okay, good morning, everybody. Thank you, chairpersons, chairmen, for the introduction. I would like to thank the organizing committee for inviting me to speak at this conference. My topic will be the characteristic of Indonesian atrial fibrillation patients. There are some studies that we did, more or less registries. So we know about the global prevalence of atrial fibrillation, which are quite high and increased more and more. We can see the projected increase in AF prevalence among elderly in the European Union here on the right upper hand here, and it is more common in males, and the lifetime risk of atrial fibrillation is 1 in 3 individuals. So remember, 1 in 3 individuals. So the Pulse Day event, which I would like also to mention here, which is on the 1st of March 2026, is a global awareness for arrhythmia, especially for the pulse in focus of atrial fibrillation. So 1 in 3 individuals. So if the 1st of March will be a global awareness due to the lifetime risk of atrial fibrillation in 1 in 3 individuals. So I hope we can share this Pulse Day for everybody, which is a global initiative done by the European Society of Cardiology, joined by HRS, the Latin American HRS, and the Asia Pacific HRS. So the lifetime risk of atrial fibrillation increase, of course, with risk factor burden, and one of the which was already mentioned is the burden of stroke, is one that is very debilitating in patients with atrial fibrillation. In Indonesia itself, the stroke burden is quite high, and the prevalence has increased in the last 5 years to 56%, and only less than 40% of patients do routine control to doctors due to the problems with the availability of clinics nearby their homes, and 63.7% are elderly who cannot live independently after stroke. And this steady increase of stroke cases is also a burden for cost every year. So a survey that we did showed the prevalence of atrial fibrillation based on tertiary hospital survey with a smartphone-based diagnosis. We surveyed almost 10,000 subjects, where we found that the mean age in this survey was 44.6 years, with women as the majority in the survey. And based on medical history, most patients had no history of heart failure, hypertension, diabetes, stroke, coronary artery disease, peripheral artery disease, and AF. But those with AF were more, here if you can see here, had more of these, and compared to those with no atrial fibrillation. And the prevalence of atrial fibrillation was also increased based on age quartiles. There's which is of course the same in many other surveys or registries. There's a trend of increasing atrial fibrillation prevalence by increase of age. We used the smartphone based with the Alive Core, and which was confirmed by cardiologists using the exact tracing. Cardiologists diagnosed atrial fibrillation in 3.5% patients, and the kappa agreement between the Alive Core smartphone base and the cardiologist was 0.852, which is not bad, and the sensitivity and specificity to diagnose AF were 82.9 and 99.7% respectively. And As we can see, the CHA2DS score for these atrial fibrillation patients, where most of them had lower CHA2DS risk. And in conclusion of this survey, the prevalence of AF based on tertiary hospital survey in Indonesia was about 3.2% in our population. AF patients were younger and most of them did not report traditional risk factors. Based on the CHA2DS score, most of AF patients in this survey are low risk of stroke and systemic thromboembolism. Another registry that we did was the 1AF, published in 2021, which showed that only 40%, around 40% were using oral anticoagulants in patients with atrial fibrillation. So it's very low in Indonesia. The problem is, compared to other countries, the direct oral anticoagulants are not yet reimbursed by our universal health care, and the only oral anticoagulant in Indonesia which is reimbursed is the vitamin K antagonist. And many people or many patients do not want to take that because of the risk involved with bleeding, and or they do not even have the availability of checking the INR in their respective clinic or home where they are close by. And based on the INR level, you can see that only less than 20% are in the targeted INR level here. So, of course, due to those who have who are taking the vitamin K antagonist, since there's because they're worried about bleeding, they only take less than the recommended dose in most patients, or they do not really check for the coagulation effect. Another study that we did was the OPTIMA study, the optimal INR measures for Indonesians. It was a multi-center observational cohort, of course, with vitamin K antagonists in AF patients with target INR 2 to 3, with a 1-year follow-up with 27 sites all over major cities of Indonesia. Just check for the efficacy and safety profile. Yeah, like in the European countries where AF is more common in males, in Indonesia also, we can see that about 53% of patients are males as well in our study. And the age distributions is quite, yeah, we can see that in Indonesia, AF is younger, more probably compared to other populations. More than 50% of the AF patients are less than, if you can see, even 60% more are less than 65 years of age in our registry, so quite young. If we compare it to the worldwide data, in Indonesia, the atrial fibrillation patients population is younger and younger. Probably due to a lot of valve disease, which is also a problem still with, especially with the rheumatic heart disease, are still problematic in Indonesia. And the comorbidities for the non-valvular heart disease is in most patients are hypertension and diabetes and chronic kidney disease. So with hypertension is the prevalent comorbidity in these patients with atrial fibrillation, which is not much different with the population, the World Bank. And the AF types, of course, is quite distributed between the paroxysmal and the more persistent AF types, with only 1/3 are less than 40% are paroxysmal, the others are persistent, long-standing persistent, or even permanent AF. between these patients who have are on vitamin K antagonists, the TTR in our population was only 30%, which is quite low. And those who have and the Hasbled is actually quite low. 95% has a Hasbled score less than 2 or 2 or less. But the CHA2DS score is actually quite, about 2.43, so not that high in the population, but still the TTR is calculated with the Rosendahl method was only 30%. If we compare it to the randomized trials like Relay, Rocket, and Aristotle and Engage, where the TTR was, of course, due to the trial, was more than 70% in these patients. And yeah, and the incidence rate of events in our population was there was still a quite high event of stroke and bleeding, and the stroke events were not significant correlated with left ventricular ejection fraction or left atrial dimension. So, and the stroke event, they had a CHA2DS score, higher CHA2DS score of 3.61 in these patients, but the INR was only 1.79, of course not on target. But on the other hand, the bleeding event was not that low, even with 6.4% per year. And these patients had actually a CHA2DS score of 2.98 and a Hasbled actually only of a rather low Hasbled score, but those with a bleeding event had a ENR of average of 2.44, so not really very high INR. And the incidence rates of event for the bleeding or for stroke, if we see, was actually stroke was quite good prevented if we had a target of ENR about 1.92 with an incidence of 14.8, and bleeding we can see here, of course, is relatively still problematic in these patients with vitamin K antagonist. Okay, I would like to conclude my talk with these conclusions. In our population in Indonesia, AF patients are younger compared to the worldwide population, and most of them did not report traditional risk factors. Based on the CHA2DS score, most AF patients in Indonesia are low risk of stroke and systemic thromboembolism, and the patients treated with warfarin achieved only 30% TTR of the target INR, but had lower stroke and bleeding rate. And the INR target for Indonesian patients treated with warfarin should be in the lower end with associated TTR of 65.4%. There's of course a genetic polymorphism that related to warfarin dose requirements, which is existent in Indonesian AFP population. Thank you all for your attention.